Okay, start the station, doctor.
Okay. Hi, I'm Dr. Chong. I'm one of the psychiatrists in this clinic. How should I refer to you?
You can call me Mr. White, no problem.
Hi, Mr. Weiss. Nice to meet you. And so, from my understanding, you have been diagnosed with schizophrenia since you're 20 years old. And so, how has your recent symptoms been?
Well, everything has been fine until lately. I'm feeling very anxious, actually.
Hmm. Uh, I can hear your concerns that you're feeling more anxious. Is there any particular reason that you're feeling more anxious?
Well, I think that I'm not going well around what's going on with in life. My particularly the neighbors are not very friendly. So I feel that this is the nurse. This is the cause, I guess.
Hmm. Has your relationship with your neighbors all
It
along
has
been
been
well or
it
not?
has been good for all nearly 15 years, but not lately. I think we have changed the having a psychiatric patient in the neighborhood. They say that
That
it's
must
not
be
good.
quite distressing to you. So could I know any what made you feel like the neighbors has been different to you?
What they are saying about me, doctor. So I don't think that anyone can tolerate and accept what they are saying. Not because I'm a
Hmm.
psychiatric patient, I accept what they are saying. They, the meaning. Words and calling me names and bullying me whenever they see me. So I'm not happy with it.
That must be quite difficult for you. So,
Yes.
uh, did you hear them as like did they
Yeah,
comment
I hear
these
them.
to
I
you?
hear them regularly. Yeah, I hear them talking about me. I hear them saying bad words.
Mhm.
But what can I do? If I said anything or did anything, I'll be admitted on the section as before. I don't want to go through this again.
I see, I see. And so, did they talk to you directly, or like where did you
The
hear
way
their
they look
remarks?
at me, and sometimes I hear this man talking with his wife that we don't want him around our kids. He's sick. He's
Okay.
mentally ill. And also they
Mm-hmm.
want to take over my house because I have bigger rooms, more rooms. They have four kids, and I'm living alone, but I have, my house is big.
So
I
it
hear them
sounds
talking
like
about all of
they are
this
trying.
together.
It sounds like they are having some plans against you. So is there any chance that they are not actually having some plans, but that you might have been mistaken, like they might
This
have
is what
been.
they are saying, doctor. This is what they are saying. This is what I hear them saying
Hmm.
this. So I'm just telling you what they are saying.
Okay, I see. That must be quite rough to you. I mean, the work that also made you feel more anxious lately, right?
Yes, yes.
Okay. And so, besides having these worries and also listening to these remarks, do you also feel like your thoughts are being interfered with lately?
No,
Mm-hmm. And just some routine screening questions, like do you have any thoughts in your head that you feel like are not your own?
no, no.
Okay, I see. Mhm. So, besides feeling more anxious, does these thoughts also, does these worries also affect your life?
Yeah,
For
doctor.
example, did
I'm confined to my house. I don't want to go out. I don't know. Maybe if I go out, they might do something to the house. They don't want me in it. So I'm staying in my house to protect it most of the time.
so that affected your life hugely. Did it also affect your sleep or appetite?
No, I'm sleeping good. I take my medications regularly.
You take your medications regularly. Okay. And I can hear your distress. You're feeling more anxious. Do you have any like muscle tension, or for example, you're feeling your heart rate is beating faster?
No, no, no.
Okay, thank you. And I can see that you're feeling um, more um, difficult to interact with your neighbors. Just wondering if that made you have any like revenge plan against them, or any
No.
plans
No, no,
to confront them.
I'm a peaceful man, doctor. I know that if I did anything, I've been admitted before under section. I don't want to go through this. I'm just
Mm,
talking with you about what have been disturbing me in the past 3 to 4 weeks.
I see. Thank you. But sometimes when people are in
1 minute
distress,
remaining.
okay.
1 minute remaining.
Sometimes, okay. Thank you. Sometimes when people are in distress, they may want to um, um relieve themselves by, for example, drinking alcohol or taking some street drugs.
No,
Uh,
no, no,
did you
no,
have
no,
these practice?
no,
Okay.
no.
Um, and sometimes when people are in huge distress, they may want to, for example, end their life as well. Has that been the case for you?
No, no, no.
Okay, thank you. So all in all, Mr. White, I think you are having some symptoms of a relapse in view of the recent distress against the neighbor, and that I would like to talk to you further to talk about some possible management. Would that be all right for you?
Yeah, yeah, no problem.
Okay, thank you.
How do you feel about what you give him some feedback? Give him some
Sorry.
feedback, please, doctors. I'm just asking our
Oh,
colleagues uh, to give you some feedback. Okay, so how do you feel about what you did? How do you
um,
feel about what you
I
did, though?
I feel like I'm also a little bit anxious while doing the station because I'm the first one to do so, and
But
I'm the first time doing so. So there may be some questions that I may not have asked enough adequately or appropriately, as also English is not my mother tongue. So I'm
very good.
seeing any feedback for
Okay.
improvement.
So because your first time, yeah, and English language, we will go through this in details how to sort out these things. Now, regarding the feedback of our colleagues, didn't elicit other exactly Dr. Rawan very clever.
Thank you.
So Dr. My first of all, you had empathy. You picked up the problem very early, and you were able to detect that it is anxiety, and you were able also to know that this anxiety is caused by his problem with his neighbors. Okay, but you could have done it in a better way. So you didn't take the complaint in a very in a professional way because you didn't know when did this onset happen. Okay, so you wanted to know exactly when did this anxiety happen and what happened after with your hallucination. So exactly when did he start to hear the voices of his neighbors, and you want to know the course. Is it increasing with time? Is it decreasing? And how was he doing before that? Was he taking his medications and his stressors? So there is a particular way by which we take the complaint because taking the complaint will help us to understand what's going on and will give a very good impression about us in front of the consultant because the consultant is expecting for you to be very systematic. It is the interview is not about asking, so do your voices, do you see things? What about controlling your thoughts? How about the mood? No, it's not about this. It's about how to have a constructed organized dialogue with your patient in order to come up with an outcome from this conversation, whether it is a task for mental state or for management or for anything. So the very first thing which you should take is to take the complaint in an organized way. So let us see how we can do this according to the notes.
I see. Thank you.
Okay. So according to the simple way, so you hear that someone is saying to you that I feel anxious. You give him some empathy and you want to understand when did this happen. Very important to understand when did this happen. Maybe he has been all of his life feeling anxious, or other than having anxiety, not more than 3 to 4 weeks ago. So definitely something has initiated this anxiety. So you want to know the onset and you want to know the course, what increase it and what decrease it. You will find that it is limited to his relation with his neighbors, and whenever he interacts with the neighbors or hears their voices, he starts to be more anxious. So the course is not only you want to know is it increasing or decreasing, you want to know also what makes it increase, what makes it decrease, and this will give you a hint to the outline of his psychosis because the anxiety is increased by his neighbors. And you want to know what happened before the onset. So if I say to you that I started to be anxious about 4 weeks ago, so how were you doing before that? You will find that he started to hear his voice, the voices of his neighbors, and he started to feel that they are planning to take his house. And then he started to be anxious until he became very anxious in the past 4 weeks. And then he eventually came to you because of anxiety, secondary to the hallucinations. And if you did not give me 1 minute, please. Come, brother. Come. Uh, there's come, please. Give me just 1 minute. No problem. Yeah. Please close the door. Sorry for the interruption. Okay, so and by the way, doctors, please pay attention to this. This is a typical example of tricks which the Royal College put for the candidates. You are always going to get something which is secondary to something else. Here you have anxiety secondary to the auditory hallucinations. And if you read the instructions to the role player, you will say that at the end of the station, later in the interview, and then you disclose to the psychiatrist that you have been feeling anxious because of the demeaning remarks. So they are keen to make the role player main presentation or the initial presentation is anxiety, and only the clever candidates who will keep digging to understand what is the cause of the anxiety will pick up that it is because of the demeaning remarks about the patient having schizophrenia. Do you understand what I'm saying, doctor? Are you following me?
Yes, thank you.
Okay. So we have here anxiety secondary to the auditory hallucinations, and you will meet this trick many times in the stations of the Royal College. They are very keen to pick up the candidates who are clever enough to understand that is that the psychiatric problems always have predisposing and precipitating factors, and you will never be able to pick up this trick except after asking the patient how was he doing before the onset and taking the complaint in an organized way. The second mistake which you did, that I elaborated for you that I am hearing voices. You did not ask me anything about the nature of these voices. Even you did not ask me about, you didn't come up with anything which can tell you whether this was hallucinations or real conversation. You did not ask any questions. So you only sufficed by knowing that I'm hearing them talking about me. This is not enough. And when I elaborate for you something like I'm hearing voices or that I'm having some problem in the area of perception, it is expected from you also to dig more in the area of perception. So if I'm saying that I'm hearing voices, you are expected to ask me more about the visual hallucinations and also if I have any other hallucinatory modalities. You understand what I'm saying? Which you did not do. Okay. The persecution, if I say to you that I have my neighbors talking about me, yes, good that you wanted to know the evidence. So what is the evidence? So if I'm hearing voices, you want to know what is his explanation for the auditory hallucination. And if I'm having a delusion, you want to know, so what is the evidence? What makes you say so? So his evidence here is his hallucinations. But it is very important also to ask in the area of persecution if there is another someone also involved in this. Okay, if someone have the delusion or the psychiatric problem which makes him more vulnerable to create persecutory delusions, it is very common that he will also have persecutory delusion on other people. Maybe he also have delusion on towards another neighbors or the government. So when you are asked about the persecution, it is expected from you to ask about if there is anyone else involved and his delusional evidence. Broadcasting and research, you did ask about it. The mood, you did not ask anything about the mood, unfortunately. No questions. You did not whatsoever. Cognition is important in one condition, in two conditions actually. If the patient is old or if it is a mood case. Usually the cognition is affected in these two conditions. If the patient is old or if there is depression or mania. Other than this, it is not very important to ask about the cognition. You ask about the impact, you ask about the coping, you ask about the risk, but unfortunately it was not one chunk. It was scattered. Okay. And then the insight, also it was bit okay, it was a bit scattered also. I expected from you to ask me if I'm taking my medications and so on, and then ask me if I feel that this is part of my psychiatric problem. Now, according to the scenario in front of us and my acting, it was not a high risk condition because the patient is, very peaceful man. He doesn't want to confront his neighbors. But if you do your risk assessment and you find out that this patient is having high risk or because he wants to confront his neighbors, he has plans towards his neighbors. In this condition, you must terminate the station by saying it is better for him to stay in the hospital for his safety and the safety of his neighbors. And there are a lot of concerns regarding your safety, Mr. X. It's better for you to stay in the hospital. Okay, so termination is not saying bye for the patient. It is very important to terminate the station properly according to the risk assessment. If there is high risk, it is very important to mention that it is important for the patient to be admitted in the hospital. Low risk, simply say that you want to see him again to see how you can help. Okay? Any questions? Do you have any question, doctor?
Thank you.
You are welcome. I hope that you found it helpful. So,
Yes,
with this,
definitely.
well, who would like to go next?
Yes, me, doctor, if possible.
Dr. May?
Yes.
I don't know if the problem in my laptop, I cannot see you, but if you prefer not to go without cam, no problem. We are recording. If you are happy with this, no problem.
Yeah, because I'm in uncomfortable situation now. I'm with my baby.
No problem. No, we all have babies. Okay, no problem. So, what is your station, though?
Uh, footballer psychosis. MSc, I think.
Okay. Okay. Take your time.
Okay. I can start.
Ready? Let's say my name is Robin. Okay.
Robin, okay.
So start now. 1, 2, 3, go.
Hello, this is May, one of the mental health doctor in the team. Are you Mr. Robin?
Yes.
Okay. So I understand that you were referred by your GP because there was some odd things happened around that time. Can you tell me
Well,
more?
well, I discussed this with my GP, and um,
Sorry, what did you say?
I discussed this with my GP, and I don't know. I'm a peaceful person, doctor. I don't want any problem.
Oh, right. So I just want to reassure you, this is your safe space, and everything you would tell me is confidential between you and me. Is that correct? Is
Okay.
that okay if you could tell me more about what's going on with you?
You know, we came from Poland, and I feel that
Mm-hmm.
people around me are not very happy. They are not very happy seeing a
Mm,
Polish person, and there's some racist issues around me. And I
yeah.
don't want any problems. Honestly, I'm a very peaceful person.
Oh, I'm so sorry that you faced some racist comments. So since when did that happen?
It started about 6 months ago.
Okay. And before that, have you faced any other things like that?
Well, yeah, since I came from Holland
Mm-hmm.
about 3 years ago, after
Okay.
6 months, I started to feel odd, and the people are looking at me in a very weird way. I
Oh,
didn't feel, this. I didn't feel warmth in the way they are interacting with me, but and until
oh,
6 months ago in the pitch, they started to say very bad racial
oh,
slurs about
oh.
me.
I'm so sorry that you've passed through these, but to get me a clear picture, you said that it has been 4 years, but what made things different 6 months ago?
In the pitch, I am a football player.
Mm-hmm.
The audience of the other team started to say very racial comments, and they kept saying it,
Oh,
and I kept hearing them even in the dressing room. And I discussed this with my coach
oh,
and manager and
okay.
other football players. They wanted, to minimize things and
Mm,
comfort me, but I'm sure I keep hearing these bad words, and I cannot tolerate.
mm.
So I decided not
Yeah.
to go anywhere and to confine myself at home, and this is better for me.
Oh dear, that sounds so concerning. So you told me many details. So let me recap what you've done, what you've passed through. So it's 6 months ago. You've been hearing these racist comments,
Yeah,
and even you're hearing when no one is around. You told me it's in the dressing room,
yeah,
and the nature of these voices are these racial things. Are there any other things that the voices are telling you?
yeah. They keep saying bad words about me, and they
Mm.
keep talking with each other about me and how they want to get rid
Oh.
of all the foreigners. Definitely, this is not a very good situation.
No, not at all. Okay, and are you familiar with these voices?
No,
Do you know them? Okay.
No,
So, meaning by them, it means not one, and they are talking about you. Did they tell you to harm yourself by any way?
no, no,
Did you tell you to harm anyone else?
no, no.
Okay. Is there any weird feeling going on with you?
Yeah, I feel well, I'm afraid, I'm not, I don't feel
Yeah.
safe if I go out. I'm staying at home most of the
Mm.
time, and all of the time actually, I close all the windows because
Yeah,
if I
that's
go
so
out,
stressful.
I'm not happy. I feel very afraid because of these voices.
Yeah, yeah, that sounds so stressful. Okay. So what I've meant by feeling, did you feel that any change in your taste or smell?
No, no.
Okay. And I could gather that impacted in your life in many way. And how could you cope with that?
Well, one thing which I can do is that I'm staying at home. I don't want any
Hmm.
confrontation with anyone. I'm
Yeah.
alone. I'm a foreigner.
Yeah. How was your sleep then?
Well, it's not the best, but I'm
Hmm.
sleeping. I'm sleeping. Yeah,
Okay, that's good to hear. And how's your appetite going on?
everything is good.
All right. Okay. So, do you normally drink alcohol?
No,
Okay. And do you take by any chance any recreational drugs?
no, no.
All right. And regarding the thoughts running in your mind, can you tell me more about it?
What do you mean?
Okay. So do you feel that you're thinking differently in these 6 months?
How? What do you mean?
Okay. The thoughts in your mind is your thoughts or anyone else controlling it?
No, no one is controlling my mind.
Okay, good. And do you think that people can read your mind by any chance?
No, no.
Okay, good. And it sounds very, very hard for you as a Polish man coming in UK and facing these racial comments. Do you think by any chance to end up that by harming yourself?
No, no, no.
That's good. And did you confront other people who you
No,
think that
I'm
they
a
are
peaceful. I
talking
don't
about that?
want to go through this.
Yeah.
Sometimes the audience gather against after the
Mm,
match and harm the football players. It
okay.
happened before. I don't want to go through this. 1 minute
Oh,
remaining.
okay. And have you seen a psychiatrist before?
No, this is the first time.
Okay. What is your explanation of what you've been through?
I don't know.
Yeah.
I don't.
But
I feel it is better for me to stay at home. I don't know why I'm here actually.
oh dear. Yeah, it sounds hard, but do you think that you might have been through these tough time and it could be one of the mental health problems that you're facing?
I don't know that.
All right. So I can see that you probably have what we call psychosis, but it would be advisable if we can have a better long chat with you. Do you think that you can wait until we have some assessments with you?
Fine, excellent, excellent.
Okay.
MashaAllah, tabarak. MashaAllah. This is the first time for you to go to the cast or to do a station cast.
First time to the Costco, but
First
not
time.
the station. Yeah.
Very good, very good, excellent. Okay, so well, you took the complaint in a very good way, but pay attention to these very simple things. As I said, always when you have a digital hallucination, so ask yourself, how come you are hearing voices which no one else can hear around you? Because most probably you can have a delusion behind the explanation. So as if Chip put in his mind, how come he's hearing the voice of the audience while he is in the dressing room or while he is at home? It is something, yes, it is a hallucination, and um, it is explained by him that it is the people around him are hostile, but how come he is hearing them while no one else can hear? Most probably you will find a delusion to explain this in his mind. Number two, if you have someone, as I always say, if someone have a mental state in which he creates a persecutory delusion, it is not uncommon to have also persecution against someone else. Yes, I said that they are the audience who are racist against me, but you want also anything else, anyone else want to harm you, You don't know, maybe you say that the intelligence secret intelligence sent them. So don't get surface. If you want to appear professional, just pay attention to what I'm saying. What you did is very good, very good. But if you want to put a cherry on top, pay attention to what I'm saying. So you want to know who else is involved in this. Maybe there are other people or other organizations in his mind also, which have the delusions, which he has delusions against. Um, الو الو عليكم السلام ورحمة الله. ايوه يا سيستم. ايوه يا فندم بعتيه جناح 8. ايوه يا فندم. السلام عليكم. Okay. Do you hear me, doctors?
Eh, I think there is something in the
Yeah,
internet, but yeah,
I
thank you so
understand.
much for your feedback.
Do you hear me now?
Yeah, I can.
Yeah. So the first thing we said, you must understand what is his explanation for his delusion and for his hallucinations, and what are these evidence for his delusion, and if anyone else is involved. Next thing, which I don't know, you asked me about thought control broadcasting insertion in a very bizarre way. You can just ask it directly. And eventually ask me directly, because I really didn't understand what I'm saying. And by the way, this is one of the things which the Royal College commented on, that the candidates approach this area that you want to ask about the thought insertion, perception, thought insertion, withdrawal, and control in a very weird way, sometimes in a very indirect way. You can ask
Yeah.
me, so all this stress, do you feel that sometimes that your thoughts are being interfered with by any way, like thoughts being inserted in your mind? Ask it directly, or being
Okay.
taken away from your mind, because you asked two questions which I felt
Yeah, it took
difficult
time.
to be understood. Okay. Other than this, it was very good, actually, very, very good. Let's see, according to the notes, what we can do. This is not a very common station to come, but comes. You took the complaint in a very good way. You wanted to know the onset, you wanted to know the course, you wanted to know how was he doing before the onset. It was perfect. And then you ask about after taking the complaint, you understand that you are in the area of psychosis or the area of mood. You will understand where is the problem, which you should start with. So definitely this is not a depression case, okay, or mood case. So this is psychosis, this is your priority, to start with the psychosis. If it is risk, the first thing for you definitely is to understand the situation which made him come with high risk, like trying to set fire in himself or so on. But here, our priority is to assess the psychosis according to the complaint, which revealed that we have a problem of psychosis. You ask about the persecution in a very good way. Pay attention that you want to know all the things which can be involved in this persecution, or all the personnel involved in this, and what is his evidence. And then the perception, very good, but you want to know his explanation for his auditory hallucination. Maybe he feels that they did put some chip in his mind, not uncommon to hear this explanation for the auditory hallucination. The broadcasting thought and session control, try to be more direct in your question. Did you ask me about the mood? How was the mood in the past 2 weeks? You feeling? Did you ask about the mood?
I think because you mentioned it, so I just asked about sleep and appetite, but I don't know if I could explore it. I mean,
No, you
in
should
depth.
have asked directly, as I said, just so that.
Okay.
By the way, some of the consultants now say that you don't ask about the mood. How was your mood in the past 2 weeks? You can just ask about the mood now, because they say that this is a
Yeah.
cross-sectional assessment.
Yeah.
It has not been always like this, but this is the new feedback from the course of the Royal College. So you want to know exactly how is his mood right now, and if you want to elaborate more to know if it is his depression or not, ask him. It has been going on for more than 2 weeks. And they also insist that you should ask any guilt feelings. Please pay attention to these guilt feelings
Okay.
or sense of worth. This is the feedback of the Royal College course. For them, this is not very important, exactly like asking the mood. Sometimes feelings of guilt, any guilt feelings guilt. Not he doesn't feel sad, but he feels that he is guilty. So for them, this is also equivalent to low mood. Okay. Impact, coping, and risk, very good. Insight, very good. And termination, very excellent. For me, it was excellent. This feedback, definitely nothing is perfect, but for me, it was very good. Thank you so much, Dr. Ulfran. Very clever, mashallah.
Thank you. Thank you so
Thank you.
much.
Who would like to go next? Who would like to go next, dear doctors?
I can go next, doctor.
Yes, okay. Okay, what is your station, Doctor?
Delirium tremens.
You also don't prefer to open your camera, no problem.
Sorry, I have an issue with my laptop.
No problem. No problem. Windows is yeah. Okay. It is a mixed task. Taking history, come. Hey. Okay, doctor. So as you can see, this is a mixed task of brief history and mental state. It is not uncommon because to have this because we have alcohol problem.
Okay. Okay.
1 minute, please.
Okay.
Okay, let's say that my name is Mr. Green or Mr. Brown, any Misters.
Okay.
Okay. Come. 1 minute.
Okay.
Sorry, doctors, for this interruption. We'll start now. Now, doctors, pay attention. This station is important. It usually comes because there is an alcohol problem in the UK, as you all know. And also, this station includes 2 tasks, taking history and mental state examination. And also, it includes some sort of challenging for your communication skills because the patient is going to be delirious, confused, a bit agitated. So you are required to calm him down and also to assess his perceptual problems because usually those who have delirium elaborate more perceptual problems. Okay. So let's say that my name is Mr. Brown, and we will start now. 1, 2, 3, go.
Hello, is it Mr. Brown?
Please, doctor, please pay attention. Pay attention. There is someone behind you carrying the gun. I don't know. It doesn't look.
Oh, you can see them now?
Yeah. I don't know why he's staring at me, and why someone is carrying a gun in a hospital, and why are all these snakes on the walls? How come in a hospital with all these snakes and guns?
Mr. Brown, I can see that you look a little anxious. I want to assure you that we are in a safe place. Nothing can hurt you here.
I don't know, doctor. I don't know, but I don't feel safe. Even I should. Maybe you're not a real doctor, because no doctor can sit with a man with a gun behind him. Maybe this is your bodyguard. What is this?
No, I can assure you, Mr. Brown, there is no guns in here. Every person around you is just doctors and nurses, and no guns are here. And you are in a safe place, so you can calm down and relax. Mr. Brown, I understand that there is some concerns about you by the surgery team. Can you tell me more about this?
Well, I did the surgery, but I don't know why they are putting me in front of someone with a gun, and why they are putting me with snakes. And maybe you are a witch.
So
I don't know. Maybe you're a witch. You're not a doctor. I don't know.
okay, so you okay, I'll assure you I'm a doctor. I'm not a witch. So you can see snakes right now?
Yeah. And this man keeps looking at me.
Okay. Do you think the snakes are the same usual size, or they are much smaller than usual?
A lot of snakes, big snakes. I
Yeah,
don't know how come
okay.
you, and one of them is on your shoulder, and I don't know how come you are not, you are comfortable with this. I don't know.
Okay, Mr. Brown, I need you to relax. There is nothing can hurt you here. Mr. Brown, do you remember what happened before you came to the hospital?
I fell down.
Okay.
And then I went to the hospital, and then I couldn't move.
Okay.
I was not able to walk.
And before you fell down, do you remember what were you doing?
I was drinking, actually, but I went to the
Okay.
supermarket and then fell down. But I
Okay,
don't
so
know
you were drinking.
why this man is looking at me like this and waving with his gun. Okay.
Don't worry, Mr. Brown. Don't worry, he won't harm you. We are in a safe place, so please be relaxed and calm down. He will not ever hurt you, I assure you. You told me, or you mentioned about drinking. When did you start drinking?
I started, I'm 70s. I've been always drinking. My father used to own a pub, so I started drinking maybe as early as 13 to 15 years.
Okay,
My
and
father
what
owned the
frequency do you
pub.
drink?
I like to drink vodka. And
Vodka.
yeah. But I'm not
How much?
comfortable with all these snakes and spiders and men. Yeah, and there's another man now with a gun, one on your left side and the other is on right side.
They will not hurt you, I assure you. They will not hurt you. Can you tell me more
Yeah,
about the frequency of drinking? How much do you drink usually a day?
maybe a bottle sometimes, between half and a bottle every day.
Okay, and when were the last time you drink?
I don't remember. I don't remember.
Okay. Mr. Brown, you mentioned the snakes and man you can see. Do you have you ever, sorry, do you experience any unusual sounds? Do you hear unusual sounds when
Yeah,
nobody is
I hear
around?
the hissing of these snakes. Yeah, hissing.
Yeah,
Don't you
okay,
hear
hissing.
this?
Okay. And do you feel any unusual body sensation like insects crawling over your skin?
Yeah, because the spiders that come to my skin, yes.
Okay. And did you experience any unusual taste or smell?
No.
Okay. Mr. Brown, do you think your thoughts are interfered by any means, like inserting thoughts inside your mind?
No. I don't know what you are
Okay. Or
saying.
do you think anybody can insert thoughts inside your mind?
No.
Okay. Or take thoughts out of your mind?
No, I understand what I'm saying. I don't understand what you're saying.
Okay, I'm sorry for this. I can see that you are in a very difficult situation now. Okay, Mr. Brown, do you think you are in control of your body and your emotions?
What do you mean? I don't understand what you're saying.
Okay, I'm sorry for this. Mr. Brown, can you now think clearly? Do you think you are able to think clearly right now?
I don't know, but
Okay, do you know where we are now?
I don't know. I don't know.
Okay,
1 minute remaining.
no. Okay, and do you think you know what time it is?
I don't know.
Okay. Mr. Brown, what about your mood? How was your mood in the last weeks?
I was fine. I was fine. Everything was okay. But now
Okay.
everything is not okay because of these people who have guns.
Okay, and do you able to take a good night's sleep?
Yeah, but I used to drink in order to go to sleep.
Okay. Mr. Brown, if I told you that what's going on with you is just your mind playing tricks, what would you
No,
say
no,
about this?
no. There are two people who are carrying guns. I don't think that I can sit in this place with all these guns around me. I don't know what's going on.
So you are sure about this.
Yeah.
Okay, Mr. Brown, you have been through a very stressful time. Did you use any drugs or recreational drugs to cope with this?
No, I mean, I'm in the hospital. I don't, time. How do you feel about what you did? Give her some
I,
feedback.
I I don't know really. I was very confused because it's a
But
two stations in one.
you did it in a very good way, by the way. I don't feel that
Thank you, doctor.
anything bad.
I couldn't know where to go to
This
history
one
or
of
go to MSE.
Rawan is very clever. She said for you risk assessment, as you can see. It's
I
very
couldn't have
important to
time.
assess the risk. Very important to ask about the risk.
Yeah,
What
yeah,
else?
but I didn't have any time.
Okay, risk assessment. No, give her some feedback. Uh, so what is your priority here, doctor? When you, from the very first beginning, what did you feel I'm suffering from?
A delirium tremens, so I have to take the history of drinking, and I have to comment over your look as shaking and confusion.
Yes, no, you said delirium. So your priority is to assess, to establish that this is delirium and assess the cognition.
Okay.
So this I understand. So if I feel from the beginning I said to you I don't feel that this is a hospital. So there could be disorientation to person, to place, and then go on with this disorientation to establish that this man has a problem of confusion. Okay. So from the
Okay.
very first beginning, your priority, and this is the first thing. And actually, if you, it was going on with the conversation, I elaborate that I'm confused. I don't feel that this is the hostile thing that you are a witch. So I'm not oriented with the place, and I'm not oriented with the person around me. Go on, go on, and establish that I'm not oriented with time. I don't also have short memory problems and concentration problems. Go on with this orientation. Go with the
Okay.
flow. As I said, and one of your colleagues said risk assessment, and in this station you must terminate definitely, because the 2 points which I'm going to talk about are closely linked together. So when you assess the risk, you'll find that there is high risk, and consequently, you should terminate the station by saying it is very important for you because of all the concerns about safety to stay in this hospital. You can phrase it by any way, but terminate the station saying that it is better for you to stay in the hospital. Okay, let's see how we can do this station. Again, doctors, you are not obliged to follow my notes, but make sure that you have a note as a reference and you know what is expected from you in the task and practice as much as possible. The preparation for this exam is not like any other exam. It is mainly a very practical approach. So practice as much as possible using a single source. Don't chunk sources going from this source to another. It will not help. So let's see how we can do this station according to the my notes. So definitely when you start this station, pay attention to the station, because when you start the station, the role player is instructed to behave in a particular way. So you must pay attention to the profile in front of you and comment on it, whether he is agitated or showing tremors. I think in this station, he will elaborate that he has tremors and so on. Comment on it. The patient will need frequent reassurance because of the hallucinations and the fear which he is suffering from. It is a mix of mental state and cognitive assessment and a brief history intake. So you must have a good time management and you must practice it. As you said, you felt that the time is not helping you. With practice, you will be able to do it in 7 minutes. There is a considerable amount of communication skills required in this station. Now, as I said, when you start the station, you need to establish 2 things: that this man is showing agitation, comment on it, it is part of the mental stage, comment on the tremors, and also check his cognition. He will talk in a way showing that he is not able to have orientation. 1 minute, yes. Okay, doctors, are with me? So the very first beginning established that he has delirium, he has confusion, asking him about the points which establish that he has disorientation. You want to know that if the first part of the mini mental state examination, orientation about the place, what floor, city, county, country. So when you ask about the items of the orientation so that you are professional, you are using part of the mini mental state examination, the part which is related to the orientation. Don't just ask questions haphazardly. You want to show that you are professional. So you want to know, to show that you are assessing the orientation in a professional way. So tell me, please, what is the place? What is the floor? What is the city? What is the county? What is the country? And you want to know what date is it? Date, month, season, person, place. And then you want to do for him the short memory test. Okay. And how can he spell the word world? And then ask him about the 3 words. So this is the part of the confusion, which is the main part of your mental state, together with the history of alcohol drinking. Regarding the psychosis, it is mainly perception. Ask the details about perception. I helped you by out denying or that I don't have anything else in any other area related to the psychosis, no persecution, control, nothing. But regarding the psychosis, elaborate as much as possible in the perception. Okay. Impact, coping, and risk is the third important point in this station. The first point we said the cognition. Second point is the second part of the task, which is history. Now, very important to assess the impact, coping, and risk. because according to this, you will say to the patient, it is very important for him to stay in this hospital in the termination. The first and fourth important point is to take in details his visual hallucinations and to reassure him. You will find also that he might have some persecution other than this, nothing more, because otherwise you will not have any time to do the station. Very many things to ask about. You must be very organized and you must have good time management. It is one of the difficult stations. Really one of the difficult stations. As you can see, two tasks, many things to do. You will be facing some sort of people, some sort of patients who can be challenging your communication skills. Okay. Any questions? Okay, who would like to go next? Thank you so much, Dr. Sam. Who would like to go next?
If there is no one, doctor, I can do another one.
No problem. What is the station which you want to do?
I can do the paranoid schizophrenia use of cannabis. If there is no one for this.
One of
Or
our
neighbor
colleagues talked
sending
about the
rays.
Lilliputian hallucinations exactly. Very important to assess the hallucinations, the perceptual problems. Yes, very important, particularly very excellent, Dr. Rahman. So what is the station which you asked me to do with you, Dr. Akin?
I can do neighbor sending rays.
Okay,
Okay.
neighbor sending me.
Okay, doctor.
Okay, give me 1 minute.
Okay.
تمام. Okay, doctor. Um, Stop sharing.
Okay.
I will put your. Oh. Let's say that my name is Mr. Smith. 1, 2, 3, go.
Hello, is it Mr. Smith?
Yes.
Hello, Mr. Smith. I'm Dr. Summer from the Mental Health Unit. I understand that you have been referred by the police because of
I
some
don't know.
incidents
I'm not
happened.
crazy. I'm not crazy. I don't know why I'm here. I want to protect myself and my mom. I explained
Okay,
everything to the police, but they didn't understand me. And
okay,
instead of protecting me, they brought me. I'm not crazy. My neighbors should stop what they are doing.
okay, Mr. Smith. No one is suggesting this. It will be a quick assessment. Just bear with me, and it will be just quick, okay? I can see that you are not happy for being here, and I can see that you look very agitated. So, can you tell me more about your neighbors and what happened?
Doctor, my mother is suffering from ulcers, and they are the reason. But I discovered that they are the
Oh,
reason of my mother's suffering.
sorry
They
for your
send
mother.
rays to my house, and my mother is
Mm,
old. She cannot tolerate, and she started to develop these unhealing ulcers. I said
okay,
to them several times to stop, but they didn't. They made fun of what I'm saying. But today
yeah.
decided to confront them.
Okay, okay, I understand. I'm so sorry for your mother. But Mr. Smith, you mentioned that your neighbors are sending rays. How did you know about this?
Because of my mother's suffering, and rays cause this. I read this. I watched a documentary about the effect of rays on human health, and I linked everything
Uh-huh.
together. They have this satellite receiver which is directed to our house, and this
Mm-hmm.
man has a big 4x4 truck with lot of device which send big,
Yeah.
I don't know, big light, and it directed to our house. And when they do this, my mother suffered. And
Yes.
I said to them to stop and to direct this satellite receiver to somewhere else. And this man should
Mm-hmm.
take away all these lights from the front of his truck. He stopped. He
Okay.
made
Okay.
laugh of me.
Okay. And when did you realize about this, Mr. Smith?
Everything made sense 3 months ago when I watched a documentary about the rays
Yeah.
and this satellite which I saw, and
Yeah. Yeah.
he did put these weird lights in front of his truck about 6 months ago, the same time
Mm-hmm.
on which my mother started to suffer from these unhealing ulcers, and he directs this
Okay.
light to our house.
So I understand that 3 months ago, when you saw this documentary, you realized that they are using rays
Yeah, yeah,
towards you, and this caused your mother ulcers. Is it correct?
yeah.
Okay. Okay. So you think your neighbors are plotting against you and they want to harm you and your mother?
Yeah.
Okay. Anyone other is involved in this?
No, only these neighbors, no one else.
Okay. And have you ever seen anything unusual in your house or around
Yeah.
the house?
Whenever they do this, I see flashes of light in my house, particularly if I turn off the light. I understand that
Mm-hmm.
they started to put on these radiation devices, so I see
Uh,
flashes.
okay. Could there be any other explanation for these flashes of light?
No.
No. So you're sure? Okay. Okay. So Mr. Smith, have you ever felt any strange taste or smell?
Doctor, yes, my food started to taste strange. I think
Mm-hmm.
this is all. They also, I don't. How come? Maybe they are poisoning the it. I started to eat only canned foods.
Okay, okay, I see. Okay. And have you ever experienced any unusual sensation like insects crawling over your skin?
No.
Okay. Mr. Smith, you mentioned this satellite. Do you think this satellite can control your thoughts or control your emotions?
No, but because I'm old, I'm young, but my mother is suffering. Because of it. She's having ulcers. So this satellite is affecting my mother because she's old, but not me.
Okay, okay. And have you ever heard anything when nobody's around?
Yeah, I can hear them plotting everything, doctor. I'm not crazy. I'm sure I can hear them
Okay,
saying that they are doing this to kick us from our house because our house is bigger, a lot of rooms in it. They have a lot of
okay,
kids, and they see
okay.
that they said that I hear the man saying to his wife, he's only with his mother. He needs only a small apartment.
Mm-hmm.
Why is he
Okay.
taking all this house?
And did you see, do you hear their voice clearly as my voice now?
Yeah, yeah.
Okay. Do they give you any instructions to do?
No, no, but I hear them talking with each other about me.
Yeah. And how is it possible to hear them when you are in your house?
Doctor, this device which they have is capable
Yeah.
to send what they are saying to me.
Mm, yeah.
Okay?
Okay. Okay. And you think this device can insert thoughts inside your mind?
No, no. But I
Mm,
don't know.
no.
Maybe if I'm weaker, I'm strong now. I can resist. But
Mm,
who knows what will happen
mm,
later on?
okay. And you think it can take thoughts out of your mind or broadcast your thoughts?
Maybe I don't know.
Maybe. And what about your mood in the last 2 weeks? How was it? How was it?
I'm very frustrated because of what they did,
Mm,
and today I started to take an action. 1 minute
okay.
remaining.
And okay. And you able to take a good night's sleep?
No, I'm not sleeping because if I slept, I don't know what they will do.
Okay. And
1 minute remaining.
you mentioned the strange taste. Did you do anything to stop this? You said they are poisoning you. So what did you do about this?
I'm eating only canned foods.
And have you lost any weight?
No.
Okay. And how do you cope with all of this stress? Do you use
The only
alcohol
thing
or
which helps me
recreational
to
drugs?
calm down, I smoke cannabis. It helps me to calm down.
Yeah,
Um,
yeah. And okay, you mentioned that you confronted them. Would you do it again?
yes, definitely. I must protect my mother.
Okay. If I told you, Mr. Smith, that what's happening with you is just your mind playing tricks with you, what would you say?
No, no. I'm sure that they will.
Yeah, so you're sure about this.
Yeah.
Okay, Mr. Smith, have you ever felt that you want to end your life to get rid of all of this stress?
No.
No, okay, that's good to know. Mr. Smith, from our conversation, I do believe that what's happening with you is a relapse of your schizophrenia, and it's not safe for you to go home for
تايم
today,
تايم
so I
تايم
recommend.
تايم تايم وانت كنت ماشيه مين انا حد جاب سيره ان انا عندي سكيزوفرينيا جبتي قلبت
Sorry,
ليه
sorry, sorry, sorry.
okay so very good but you pay attention to the following that when I mentioned to you that I am suffering from or I have an auditory gustatory hallucinations you should ask me about it immediately don't later on mention that you remember that I mentioned that I have strange food taste. And you asked me what did you do about it? Actually, it was a very disorganized assessment of the hallucination because it was a very late question about a symptom which I elaborated before your question, maybe by 2 to 3 minutes. When I mentioned the cannabis, this is very important. Tell me more about this. One opening angle. Since when are you taking
You
cannabis?
didn't mention cannabis.
No, I mentioned when you asked me that how do you cope with this, I said to you that I'm taking cannabis, the only thing which makes me calm down.
I'm sorry, I didn't get it, so I'm
You
sorry.
did not hear it. It is one of
Yeah,
the because this man is taking cannabis for a long time and
yeah, sorry.
with heavy doses, and now he elaborated psychosis. Pay attention. Don't say something which is not mentioned in your uh, feedback because this means that you are not professional. Okay.
Okay.
And sometimes this means that also some might consider that you are not a safe practitioner, you are giving symptoms or giving diagnoses which are not there, and you can have a severe fail. Don't you ever do this. A big
Okay, I'm
mistake
sorry.
saying that the patient has schizophrenia, he does not have schizophrenia. No one mentions that he's having schizophrenia. Why do you say to the patient that you have schizophrenia? Okay, let's see the feedback of our colleagues. Okay. Nobody could give you any feedback. Where is it? Davidson, yes. So let's see the role players now. So this man is healing people are talking about him. There is some sort of plan in his mind from their part. They hear them most of the time clearly, and also the food tastes strange. He decided to confront his neighbors. Okay, so and he started to act according to his delusions. He went to the police. He went to the district council. So this man is totally under control of his delusions. Okay. Was very clever from you that in the very first beginning you paid attention to the instructions given to the patient that he should elaborate that he is agitated, he's not happy, he is defensive. Very good that you, but don't say that I can see that you are agitated. Don't say this. This is a very not good. It can provoke the patient. Say that I can see that you're not happy. That's good. Let's say I'm here to help you, and in order to help you, I want to know about more about what happened. Don't say agitated. Don't be judgmental. You took the complaint in a very good way. You wanted to know exactly since when did he feel that they are annoying him, and is it increasing or decreasing, and how did he notice that? Yes, before that, how was he doing? And you'll discover that everything is related to a documentary. And before, did you ask me how were you doing before that? Did you ask me?
Yes, I asked you. Yes,
Okay.
yes, and you told me about the documentary.
Yeah, okay. No, documentary is the onset. How was he doing before the documentary?
Yes, I asked you about this.
Okay, so before the documentary, there was a delusional mood. So this is the trick of the Royal College. So this man is talking about persecutory delusion secondary to his auditory auditory hallucinations and so on. Okay, so you asked about the perception. Did you ask me about that perception? Oh, you asked me about the perception. You asked me about the persecution in a very
When
good
you
way,
saw the
broadcasting
documentary.
and control. You asked me about the mood, did you? Yeah. I was in the
Yes.
mood. The screening question of the mood is two. Don't miss any of them. Yes, it is a psychosis. The screening question, how was your mood, or how is your mood, any sense of guilt? So how does he feel? And the anhedonia. So this is the feedback of the Royal College. So what is his mood, any sense of guilt or worthlessness? And then the anhedonia. So this is how you screen for the mood. Okay? Are you with me,
Okay.
doctor?
Yes, yes, I'm with you.
Guilt or okay. Cognition, as I said, cognition is important in case of mood or geriatric patients. Impact, coping, and risk. I think you asked about the impact. How did this all affect his life? Maybe you will add some details that he went to district council, he went to the police, he is staying at home. A state, a condition of the condition of the patient is totally dominated by his mental state. So definitely, it is not just a trivial thought. It is a mental problem. How is he coping? Very important to ask this question. I said to you that I'm coping with cannabis. If you ask me one open-ended question and one close-ended question, tell me more about this, Mr. X. So how many cigarettes are you taking per day? You will show to the examiner that you paid attention to this important point in his mental state. According to the risk, you are going to terminate. Very important, doctor, and this is one of the things which the candidate forget. Now, this is someone who is brought to you by the police because of a risky incident. So you want to do, to some extent, some assessment of the risk. So tell me, if you went what are going to, if you are supposed to go back home, what are you going to do? Any plans to face them again? What is in your mind? And you'll find that this man is still dominated by his delusions and he wants to confront his neighbors again. Accordingly, there is high risk, and you should terminate by saying that he should stay in the hospital. This is the feedback was given to me by one of the consultants in the Oxford mock exam. You can do everything good, but you might not pass because you are considered to be unsafe practitioner. There is a high risk patient according to the mental state examination, and then you are going to let him go back home. Well, they have a point actually. Okay, so according to the risk, you are going to terminate your station. If there is high risk, say to the patient, it is better for you to stay in the hospital. You can phrase it by any way, but show to the examiner that you are a safe practitioner and this patient should stay in the hospital. I hope that you found it helpful, doctor. Pay attention to what I'm saying. Okay, very clever one. So,
Thank you. Thank you.
anyone else? We have still have how many stations left? I don't know. Anyone else want to do any stations? Have we finished? I'm waiting. Maybe if someone wants to do any station. Morbid jealousy, old, late onset psychosis.
If it's available, I can do another. I don't want to be jealous and take all the stations,
No,
but if
no, no.
there is
You
no
have
one,
all the right. If someone does not appear, he books a station and doesn't appear, you have the right to take it. You are more than welcome.
thank you, doctor.
Yeah, we have paranoid schizophrenia with cannabis, psychosis, morbid jealousy, all female, suspected, all late onset psychosis.
Okay. I can take all the female suspecting her neighbors if no one wanted.
Okay.
I'm sorry to take all of this.
No, we are not sorry. Very good. Very excellent.
Thank you,
We
doctor.
are
Thank you.
You are more
Thank you
than
for your
welcome.
time, for your effort. Thank you so much.
You are more than welcome. Okay, so this is your station. You can see it's very close to the previous station, by the way. Very, very close.
Yes. Yeah.
So instead of Ray sending smoke, barbecue, very close.
If you want to have we to do another one, it's
Yeah, I
okay.
prefer to do another station. You will not find any
Okay.
benefit of repeating a very close station. Okay, so let's see another.
Okay. It's yes.
We have psychosis with morbid jealousy if you want to take it.
Okay. Okay, doctor.
Okay. Let's say that my name is what? Choose for me a name, no problem.
Mr. Brown?
Yes, I'm Mr. Brown.
Okay.
So 1, 2, 3, go.
Hello, is it Mr. Brown?
Yes. Yes, I'm Mr. Brown.
Hello, I'm Dr. Summer from the Mental Health Unit. I understand that you have been referred by the police because of some incidents happened early in the day. Can you tell me more about this?
Yeah, I was speeding because I wanted to go to my wife's workplace because there is something
Why
going on, something personal.
Okay, can you tell me more about this?
It is just something personal and embarrassing, which I'm not feeling happy talking about.
I'm sorry for you feeling like this, Mr. Brown, but I want to assure you that anything you will say, it will fall in the confidentiality between doctor and patient, and no one will know about this.
Well, my wife is having an affair with her boss, and I just wanted to prove it in order to stop the default procedures or taking action to
Okay,
stop this from going on. I cannot tolerate this.
okay, I understand. So when did you realize this?
I started about 3 months ago because she kept
Mhm.
going to the work in weird times and and she doesn't answer the phone, so I know that there
Yeah,
is something going on.
okay. And have you asked her for any explanation for these behaviors?
I was talking about work commitments.
Okay. And before this time, how were you been?
Well, I felt that there is something going on between her and her boss.
Okay. There were any stressors in your life before this?
Well, I hear them talking with each other.
Yeah, you heard them talking. How
Yeah,
did you do this?
how did I do what?
How did you hear them? You hear them in phone or what?
Well, while I'm in my house, I hear them talking with each other.
Yes, in your house you heard them.
Yeah,
Where their voice was clear like my voice now?
no whispering, definitely.
Whispering, okay. And what they were talking about?
They're talking about you know, very private issues and sexual things.
Yeah, yeah, I understand. Okay. And have you ever seen anything unusual?
No,
No, okay. Have you experienced any unusual taste or smell?
no,
Okay. Do you think they are plotting against you or they want to harm you?
no. They don't not gonna engage me. They are plotting with each other to have an affair with each other. She should know
Mm-hmm.
better.
Okay.
She's supposed to be a mother and wife.
Okay, Mr. Brown. Mr. Brown, have you ever felt that your body is under control of any outer forces, your actions, your emotions?
No, no,
Okay. And do you think anything can interfere with your thoughts, like inserting thoughts inside your mind?
no,
Okay. Or taking thoughts out of your mind?
no,
Okay. Do you think your wife and her boss can read your mind?
no.
No, that's okay. What about your mood in the last 2 weeks, Mr. Brown? How was it?
Well, I'm very stressed out. Very stressed. So I keep
Yeah,
hearing
yeah, I
them
can
talking more
see.
and more.
Yeah, I can see this. And do you have any feeling of worthlessness or guilt?
I feel definitely that I'm angry. Why is she doing this? I
Mm,
try to make her happy as much as I can.
yeah, I understand. What about your sleep? Do you able to take any good night's sleep?
No, no,
Mm. And have you noticed that you lost any weight recently?
no, no,
Okay. What about your energy? Are you able to do your daily activities?
I'm able, but I'm not able to focus on anything, doctor, because I keep thinking what they are saying, and I keep hearing them.
Yeah. Yeah. So you cannot think clearly recently, is it right?
Yes.
Yeah. Okay. And how do you cope with all of this stress? Do you use any alcohol or recreational drugs?
No, no, no.
No. Okay. Mr. Brown, they found a knife in your car. What you intended to do with this?
Well, I just wanted to threaten her boss and make him stop.
But you didn't want to harm them, just threatening?
Yes.
Yeah, okay. And what about your speed? Are you speeding or driving unsafe recently?
I just wanted to make sure that I will be there on time to just to face them in the act.
Okay, and would you confront them again?
I just want them to stop cheating. I want her to stop cheating.
So you may use violence.
1 minute remaining. I don't know,
Okay.
doctor.
Okay. Have you think about ending your life to get rid of all of this stress?
No, no.
No, okay. Mr. Brown, if I told you that what's happening with you is just your mind playing tricks, what would you say about this?
I'm not crazy. I'm not crazy. My wife is cheating me.
So you are 100% sure?
Yes.
Okay, thank you for your talking to me, Mr. Brown, and for opening with me. I recommend you stay with us in the hospital for a few days until it's safe for you to go home, because I'm a little concerned about your safety and safety of others. Is it okay with you?
Okay. Fine. How do you feel about what you did? Give me feedback about. Give
I
us some
tried
feedback.
to
Get some feedback. So what's wrong now? Yes.
I tried to cover most of the domains. I'm not sure was it
So
good
what
or
is your
not.
priority? What is it? Someone is brought to you in your, suppose that you are in the ER and someone called the
Yes.
doctor to come and said this patient brought by the police because he was speeding and he's having a knife in his hand in the hospital and there is some sort of risk. So what's your priority in this
Risk
condition?
assessment.
So the first thing is to do is you want to know exactly what is going on and why was he speeding and what is the knife is for. And you want to do a risk assessment. Okay, very important. This is a very, you should do it either the first thing or very close to the start of your station.
Okay.
Okay. Number
Okay.
two, how did you hear the voice? I don't know. This was a very odd question. How did you hear the voice? You can, I think you can phrase it in a better way. So you say that you are hearing them talking with each other. Can you tell me more about this? You hear them while they are present or far from you. Okay. So can you explain
Okay.
to me how come you are, so just make your question more palatable. So
Yeah,
you
yeah.
said that you can hear them while they are not around you. And you told me more about this. How can this happen? But when I
Mhm.
said to you that I'm hearing them talking with each other, and you directly asked me, how do you hear them? It was not a very good question. When
Okay.
you ask me about self-harm, don't phrase the question as if you are suggesting. So, did you think of hurting yourself to get rid of all this stress? This can
Okay.
sound like the just so. Bit I'm worried about you, Mr. X.
Yeah.
I'm worried sometimes, or with all this stress, people might think of harming themselves. Has this ever happened
Yes.
to you? Phrase it in a better way because the way you did it, it sounded as if you are suggesting that in order to get rid of all this, you can end your life.
Okay. Yes.
Let's see, according to the sheets. Okay. A long scenario, I understand, but it will be helpful to read it because you will pick up the what the role player is going to say. So the station will be more, you know, you will get accustomed to it. No surprises will be in the station, and this will help you to be more confident in the station, and definitely it will be reflected on your performance. To understand what the role player is going to do and what he's going to say and the instructions getting to him definitely will help you to perform in a better way in the station. Don't miss reading the role player's notes. Okay? Okay. You will have a defensive patient in the start. Try to show empathy and explain to him that in order to help him, he must help you because you are here to help him throughout this problem being brought by the police. And you can show some empathy that I know that being brought by the police can be a sensitive situation. However, there are some serious concerns which I have been asked to discuss with you. Rest assured that I will do my best to help you. Is it okay to proceed? Okay. Some consultants ask that you should also incorporate the details of HSCR, like asking him, tell me more about yourself. Do you have a job, any children? Part of the HCR risk assessment. Okay. Now, if you take the complaint in the right way, you will find out that he started by having the auditory hallucinations, and then he started to have these delusions that his wife is cheating him. So if you take the complaint in an organized way, professional way, you want to know the answers. So he started to read that his wife is cheating on him 3 months ago. Why? Because she is taking more and more time over time, and she's not answering the phone. This is the course. How was he doing before that? You will elaborate that he was having auditory hallucinations. The clever candidates are the only candidates who will be able to pick up this trick. Let's see the scenario. The scenario say that the voices were 4 months ago, but he believed that his wife is cheating him 3 months ago. So the sequence is auditory hallucinations followed by the delusion of infidelity. Are you following me, doctor? Okay.
Yes, doctor, I'm following.
The complaint, as you said, take it in a professional way. If you are a consultant and seeing someone who is assessing the complaint in a professional way, makes a big difference. Not just asking him what's going on and you are talking haphazardly. Being organized is something which can make a big difference in your assessment. Okay, you can have 2 ways, as I said. Now you know that this is man who is having a risk. So you ask him about the risk, okay, and ask him the details about the psychosis, which you did. But I think in this there's a mistake here. You should ask about the risk. Tell me more about this, or you ask him in a very closed time before the close to the start of the station about the risk assessment. Okay, so tell me more about this this life and why were you speeding and so on. Then you go through assessment of the psychosis. Here I did put the risk, but you are supposed to assess the risk early in the station. It is a mistake in the paper which I'm going to. Okay.
Okay.
The details of the auditory hallucination, I hope that you ask me more about the details of the auditory hallucinations. It was a very important point in the history. I expected from you to tell me more about, are you hearing them frequently? Is it clear as my voice? Do they talk with each other about you? Do they give you more orders? You should have taken more details about the auditory hallucinations. Then you asked me
Doctor,
about
when I
the
asked about the details, you said it's private and you don't want to share the details
details of what?
of the hallucination of the voices.
It's
I
not
asked
about
about mhm.
what do they take. Details is itself is not important, but commenting on whether it is a comment. Do they comment on you? Do they give you orders? I
Okay.
don't want the inappropriate details in these hallucinations. I want to know the nature of the conversation. If it is a commentary, running commentary, or it is orders. Okay, did you understand what I'm
Okay.
saying?
Yeah.
Okay, the impact on his life, which you asked about, very good. The risk. Now, this is a high risk patient. You should have said, you said, I think you terminated by saying that this patient should stay in the hospital, didn't you?
Yes.
Yes, very good, very good. So the only thing which you should pay attention here is to assess the risk early as possible, okay? And to
Okay.
pay attention to how you phrase the question about the risk of harming himself. Don't pose it as if you are
Yes.
suggesting that he should harm himself. Okay, thank you so much, Doctor. I hope that you found it helpful. I will correct this in my papers. Okay, we still have
Thank
two
you.
stations. Anyone would like to go next? Even if you, Doctor.
I can
Okay.
do anything you want, doctor. Whatever
No
you want.
problem. Don't. Okay, you are welcome. No problem.
Thank you.
Yes, this is the psychosis with morbid.
Hello.
No, this is psychosis morbid just you have just did.
Hello.
Yes.
Hello, doctor. Can I go next?
Okay, no problem. Okay. What is your station?
No, I haven't prepared anything, so I'm asking to be kind on me. This is my first time to do a station.
Okay, okay. If you are able, definitely it would be better to prepare stations. I don't know, those who have booked the station, please next time try to be more committed, because as you can see, it can be a waste of time. I can hardly arrange time for these sessions. Okay, so this is a station which is a bit new, the paranoid schizophrenia with the history of cannabis. So this is
Okay, one second. Um, can I read the task first, please? I haven't
okay.
finished.
Doctor, is it the case of being non-engaged or the case of
What?
paranoid schizophrenia cannabis? Because there are two stations in the list. One of them is about paranoia, is about psychosis and non-engagement, and the other one is about paranoid schizophrenia use of cannabis. Are they the same one or what?
Okay, I will check this, but let me see this space station.
Okay, it's number 4 and number 7. I don't know which one is this.
No, this schizophrenia and non-engagement is a totally different station.
Really? And this one in the candidate note noticed that he has not been engaging well and is rarely living in his room. Okay, so
There
the
are
other
two
one is
stations,
different.
Doctor.
Okay, okay.
Yeah. O- Okay.
Are you ready?
Yeah, I hope so. Yeah. Is my voice clear?
Yes.
Good.
Okay, Doctor. Where are you, Doctor? Can you just
The camera is
Dr.
turned.
Dr. Rana, isn't it?
Yeah. Next time I will make sure to turn it on for
Ah,
better.
the camera is not on. No problem if you are comfortable, but sometimes I need to assess the facial expression.
Yes, it's
Okay,
for better.
I hope that this is not part of anxiety, because in the exam, if you have anxiety and you're not able to control it, um, and the best way is to control it is just to try to show yourself in the exam in these meetings, and try to have regular practices and so on. If you have anxiety and you continue on doing these revisions without showing yourself in the exam, you will have severe anxiety because you have a problem which you did not manage. I hope that this is not the case here. Okay, pay attention. So let's go on. Let's say that my name is Mr. What? My name is Martin. 1, 2, 3, go.
Hello, Mr. Martin. I'm Dr. Muhammad from the mental health team.
Hello.
I understand your carer are a bit worried about you. How are you doing?
Well, I'm not happy because everything now is contaminated after the corona issue.
Tell me more about that, please.
The food is contaminated, and now people are always, they stop wearing masks and they are coughing and sneezing everywhere, and definitely this will make everyone contact the illness.
And this has affected you to the degree that you stopped eating food?
Yeah, the food is not also is not clear because the people it's now are not very health wise. So definitely those who are cooking the food are not going to pay attention to this, and I might get any infection.
Okay, and since when you started thinking that the food is contaminated and is not clean?
Well, it's not about maybe 4 months ago, something like this.
What happened then?
Well, nothing. I paid attention that the people now are not health wise, they are not careful like before, and I might get coronavirus.
Okay. And do you think that someone may be trying to poison you, or it's only the coronavirus?
No, the people should cover themselves and stop sneezing, and in the kitchen of the hostel, they are not very health wise. They keep smoking and coughing, and it is totally a mess in the kitchen.
And what is how did you cope with that?
Well, I'm staying in my room. I feel that if I went out, I cannot. I will contact illness.
Mm-hmm. So you became more isolated after
Yes.
then, right?
Yeah.
Okay. And did you start to sometimes people when they are in such stress they start to take drug or alcohol. Have you experienced taking the drug or alcohol lately?
No. No.
Uh, drug or alcohol or
Yeah,
let's talk
no,
about both.
I'm health wise. I don't do anything.
Okay. So you only became isolated. Do you still go out and enjoy what you used to enjoy doing, or
No.
so you became more isolated and stopped going out?
Yes.
All of this has affected your mood?
I'm always fine. Always fine.
Okay, but you started not going, but did you still enjoy like the enjoyable things in life, like what your habits, doing your habits and hobbies and
Yeah. Everything is fine, but I cannot go out because of the infections.
uh-huh, uh-huh. I can see that you are very concerned about the infection and that and this concern has affected you dramatically. I can see. And let me know about your thoughts. What have you been thinking of lately? And this sort of contamination, did it make you wash your hands regularly,
Yes.
more than one time?
Well, I just tried to be cautious. That's it. Not more than one time. I avoid any contamination, and this is enough. I don't go out of my house.
Uh-huh, uh-huh. Okay. And I believe that you were discharged on olanzapine. Am I right? Last time you were admitted, you were discharged on olanzapine.
Yeah.
Are you compliant on it?
No, I
You
don't.
take it
It,
regularly.
it it made me fat, and I stopped it because I was sleeping too much.
Again, please, what did you experience with olanzapine?
Weight gain. I was gaining too much weight, and I was sleeping too much.
So you did stop the medication.
Yeah.
Uh-huh. And what about your sleep? Have you been sleeping since you stopped the olanzapine?
No. When I stopped it, I was not sleeping well, but I preferred to stop taking it though.
Uh-huh. Um, uh, okay. Have you experienced any abnormal sensations lately?
Like what? 1 minute remaining.
Like anything? Do you hear any abnormal voices no one else's can hear?
No.
No one around can hear around you.
No.
Okay. Around any abnormal sensation or on your hands or on your body.
No.
Okay. Any abnormal taste of the food?
No.
Okay. That's great to know. Um, what about your thoughts again? I'm sorry to ask again. Do you feel like someone can control your thoughts?
No.
Make you do something you don't want to do?
No.
Okay. Anyone can broadcast your thoughts on TV, or you can watch your thoughts while watching TV.
No.
That's great to know. And about all of this going on about contamination, do you feel like it might be your mental illness coming back again and that needs attention from us?
No, I think that the problem is not me. You don't understand what's going on. I have contacted illnesses because of your perform, and even you are involved in this.
Mm-hmm.
1 minute remaining. Stop. No. Time. Sorry. How do you feel about what you did? Time. Sorry. How do you feel about what you did?
So, the anxiety multiplied by 100. Actually, I did sessions with my friends before. I was much more convenient doing it, but now doing it like in the real like exam situation, the anxiety multiplied by 100.
Yes,
So I
yes.
didn't.
Well, doctor, I understand. I also have exam anxiety and have anxiety in general. And the only thing which will help to cope with this anxiety is to practice as much as possible, particularly
Yeah.
in groups. This will help you to be more confident. The second thing is to read the role players' notes. You will understand what the story is. You understand what I'm going to say to you whenever you ask any questions. You will understand what are the instructions to the role player. So very important to read the role players' notes. Very important to practice as much as possible. Now, the task here is complicated, is to take a history of the recent events and to assess the mental illness. So you have two parts of the task. This type of stations needs practice because time-wise, it's a bit challenging. So let's see how can we do this station according to the notes. Show empathy while hearing his complaint. There are different ways. This is the table which contains some empathy sentences. It is not a psychotherapy session. Enough to use 2 to 3, 4 sentences enough during this station. Okay, the first thing is to pay attention to your construct of this approach. Otherwise, of your approach, otherwise you will miss the station because of the time. So you want to know the complaint. What is the current situation? You want to know. I would like to know more about your current situation. Can you share with me why you were admitted to the hospital? He has been admitted to the hospital, then he was transferred to another place because the nursing staff and the management team did not feel that he is well enough. So you want to know the story. So tell me more about why you were admitted to the hospital. When did this? What was it under the Mental Health Act? It was under the Mental Health Act. And then he was transferred to the hostel. How do you feel about being there? You will find that he's not comfortable there. He's feeling that the consultant is conspiring with the mates there in order to make him contact some infection. So this story says that here he's suspecting this consultant. I don't know which were. There's a lot of story here. You believe that you have contracted cancer, and you also believe that the consultant is involved in this, and he is asking the mates to also to transfer to you some sort of infection. This part of, you will find it in all these details of the story. Okay, I know that this can be a bit boring to read all the story or in the role player's note, but it's very important to understand what is expected from. So the story goes that while he is in the hostel, he's not happy because of many details related to his persecutory delusions. Okay. So you want to know the onset, you want to know the course, and you want to know how was he doing before the onset. So the onset started by stopping his medications. And before the onset, he was not happy with the medications because it gained weight and so on. Very important to take the complaint in a very organized way. Okay, it is different from taking the complaint in the mental health, in the mental state examination, because this is how to take the complaint in the history taking stage. You want to know the current situation and the details related to his current situation and the current onset course and before the onset. Are you following me, doctor?
Yes, yes.
And before the onset, a lot of details. Okay. I want to know why did he stop the treatment, any recreation drugs which you are, so details of taking of the biopsychosocial areas of his life. And then the symptoms of the syndrome. The symptoms of schizophrenia, where you will cover the mental state and the part of which is the second part of the mental task. So the man is having schizophrenia. So while you are assessing the schizophrenia, you are also doing the mental state. You will ask about the persecution, the perception, which you did in details. And then the mood. Enough to ask 2 screening questions about the mood, particularly the anhedonia and the mood. Okay, don't miss this, please. Very important to ask about the comorbidity, because this is a history taking station. So you might have, the patient might have comorbid issues, not only in his mental state, he might have social issues, he might have physical issues. Okay, when you ask him about his social issues, while he is, there are 2 parts of his social life now. One in the hostel and one outside the hostel. So you want to know more details about his hostel and more details about his family life outside. And then physically, you want to know if he is suffering about any medical problem. He will mention that he has cancer. He has contracted cancer because of the consultant. Okay, so this is a point left for the candidates who are clever to assess the comorbid issues related to the patient. Impact, coping, and risk, you will find that it affected his life. How did this affect his life? He lost weight, he's confined to his room, he is not very cooperative, even he to stop taking the medications because he is suspecting the medical team. Okay, so there is high risk on him. Impact, coping, and risk. And then finally, if you want past history and family history, this is part of the family history assessment. The approach to this station is different from the mental state examination stations. I put it here because it is mentioned also in the task to do a mental state examination, but primarily it is a history taking station. So in this station, you want to know if there is any past history or family history for the patient, and finally delivering the diagnosis to the patient that he is still having active psychosis and it is very important for him to stay in the hospital. You might find it cumbersome and complicated what I have said, but with practice, you will find all what I've said is very relevant to the task. Pay attention, the task here is what? What is your task now? In order not to miss anything, is to take history and to assess the mental state. So pay attention. It is mainly taking history, and part of it is mental state assessment. And where are you going to do the mental state assessment is while you are assessing the symptoms of the syndrome. There is a particular construct for history taking. Part of it is assessment of the syndrome. Okay, and here the syndrome is schizophrenia. This is the part which you are going to do the mental state. You will understand what I'm saying if you looked at how to do the history task in my YouTube channel and when we start the history task in the next Zoom session. Thank you so much, Doctor. I hope that you found it helpful. I will post all these our Zoom session today on the YouTube if you want to revise all what I've said today. And if you find what I'm saying is a bit difficult to comprehend, you can have a look at my YouTube channel, the history task, how to do the history task. You will find all what I'm saying is understandable. Thank you so much, dear doctors. I hope to find all your names in the pass list. Now we have finished all the stations, nearly all the stations. Maybe
Thank
one
you.
or two stations are left in the mental state. It will not make a big difference if you mastered all what I've just said. You will not find any difficulty in doing the remaining two stations. We will start next time the history taking station. Please, doctors, please, please, if you start from now, it will be a very, very good plan, because you don't understand how much time run fast. Within a blink of an eye, you will find yourself in August, and then it's over. Nobody will prepare in 1 month. Take a role, one of your study partners from the group, and start from now the mental state examination. The good news, it is not easy to master, because it's something which you do regularly, and also not less than 4 and sometimes 5 stations come as mental state examination. Very big part of the exam is mental state examination. Thank you so much, doctors. Have a good night.